Welcome to Hey Dr. Sue. So people submit their sex questions to me anonymously, and once a week I post one question and one answer. Do you have a sex question you've always wanted answered? Go ahead and check out the description for information on how to submit it anonymously. This week's question is way longer than the title implied, so let me read the whole thing. I can't get an erection when I'm with a woman. I've been this way since I was a teen. I used to just have difficulty getting it up, but now I'm seeing someone new that I'm very attracted to, and twice now I've had to suffer the excruciating humiliation of a soft dick. It makes me feel suicidal. I've never had any problem getting hard by myself. So there's a lot going on here. And first and foremost, if you think you're suicidal, please get help. You can contact the suicide hotline at 988, or if you just want to talk, maybe you don't feel like you're in crisis, you can contact a warm line in your state. If you don't know how to find one, you can just Google warm line and your home state, or there's a link in the video description to a website that can get you that information. Having a soft dick when you don't want one can be embarrassing. And I don't think it's going to make you feel any better, but the truth is that most men do struggle with this at some point in their lives. And also, keep in mind that if your dick isn't working, there are other things you can do to please your partner. You can use your mouth, fingers, sex toys, all of these, a combination of these to get your partner off. But let's get back to your question. There's a myth that if a man is turned on, he's automatically going to get an erection, and that's just not true. There are a lot of reasons why men don't get erections. One is that there's something physically preventing it. So normally I would say to take a look at what medications you're on. Lots of drugs, including blood pressure medications and anti-anxiety medications, can make it difficult for a man to get an erection. There are also illnesses and conditions like nerve damage, blood vessel issues, and diabetes that can make it difficult for a man to get an erection. But you said you can get one on your own, so I'm thinking these are not the issue. Are you using any substances right before you're trying to have sex? Maybe drinking a little to try and relax before? The reason I ask is that smoking and or drinking alcohol can both impact your ability to get an erection. If it's not any of these, then I'm thinking there might be something going on mentally. Fear, anxiety, depression, all of these can make it more difficult to get and keep an erection. If none of these sound like they may be the issue, then I have what may at first sound like a strange question. What are you thinking about when you're in these situations? Sometimes when people find it difficult to get an erection, when they're in sexual situations, that's pretty much all they're thinking and worrying about. We sometimes refer to this as spectatoring. If you're mentally stepping out of the moment and just thinking about whether or not you're going to get an erection, that can actually make it less likely you're going to be able to get one. And by the way, spectatoring can happen to people with all sorts of sexual issues, including having problems reaching orgasm and also not getting as wet as one used to. So let's say you've gone through the mental checklist of things. You don't think it's a medication issue or a substance issue. You're pretty sure there are no health reasons why this might be happening, but this spectatoring thing sounds like it might be it. So now what do you do? When you're in these sexual situations with a partner, check in and see what you're thinking about. If your focus isn't on what's happening between the two of you, then try to bring it back there. If it's a spectatoring issue, the more mentally present you can be, the better the chances you'll be able to get an erection. Have you talked to your partner about what's going on? I know it can be embarrassing, but they may be worrying that you can't get an erection because of them. And if you have an honest conversation with them, if you let them know it's a struggle, that you really are turned on, but your body isn't responding the way you want it to, they may be able to help you focus and be in the moment when you're together. And that can be a win-win for everyone. If you're still struggling with this, and you may want to reach out to a therapist or counselor to talk about it, but be warned, it can be hard to find someone that specializes in sex. So make sure you're doing some research on the person's training before you talk to them. Until next time, be safe and have fun. Did you like that video? If so, make sure to like and subscribe to the channel. That way you'll know when new videos come out. Also check out the description to find out how to find me on Instagram, Medium, and Twitter. And make sure to check the description for links where you can submit your sex question.